It's another pleasure this morning to introduce our speaker that you'll see throughout the day, Valerie Rogers. Valerie is the Director of State Government Affairs for HIMSS National. She joined HIMSS, I think, about a year ago, and her main purpose is engaging our state officials and our HIMSS chapter advocacy volunteers at the state level and at our state HIT policy development. So before coming to HIMSS, she's got great experience in public policy and informatics, particular focus on local and national public health programs. Most recently, she was the Senior Director of Integration at the Association of State and Territorial Health Officials. That's I won't ask so, and where she worked on health system transformation and integration issues. And she spent many years in Baltimore as the Chief of Staff in the Health Department. I could go on about some other accolades of Valerie's. She holds a Master of Public Health from Tulane, and we're just really happy to have her at HIMSS, and it's a pleasure that she came out from Washington today to be with us. So, Valerie.
Thank you, Marcia.
Sure.
So you've heard about MACRA. Obviously, the focus here is health system delivery reform, really overall health system transformation. What I think is fundamental here, and what you'll also see, so bottom line is IT's role is fundamental in what's taking place here. And this is definitely a perfect time, as you can see listed. Obviously there's a lot of interest in health information technology. There's a lot of interest in what's happening with cybersecurity and exchange of information. Increasing demands from consumers for access to information and for researchers. So fundamentally, as we sort of shift within our evolving health information technology system, you can see that really health IT has a profound role in what happens. So yes, payment models, delivery system reform is definitely important, but I think underlying that is the value of health IT. And so why HIMSS and why is HIMSS involved in this? Well, obviously, of the 52,000 members that we have worldwide, and I don't think I need to tell you sort of the value and the focus of HIMSS, which is really to see transformation and impact health in positive ways through health IT. In California, you're really fortunate to have, I think, just over 5,000 HIMSS members to help advocate and support innovation and really elevation of the issues relating to health IT in your state. So, obviously kudos to our chapter advocates for both Northern and Southern California coming together to convene you all to really talk about how to make greater impact and connecting with state legislatures. I mean, obviously there's a certificate of honor signed by the Lieutenant Governor here that really I think speaks volumes about the role and value of your advocates in moving these issues forward. And this next slide is really just to emphasize what I think Ian will talk about in greater detail later, particularly as you prepare for your legislative visits. Bottom line is that we want to come away today with increased awareness of the value of health IT. Jeff talked about MACRA. I'll touch a little bit on some of the Medicaid modularization activities that are happening as well. That these are sort of state-level policy levers that can be potentially impact the innovation efforts and the use of health IT in your state. But I think overall, just in terms of where you all are as members of HIMSS, both the North and South chapters, as chapter advocates, is really to emphasize that chapter advocates are leaders and members and have really valuable input in the policy decision-making process. So we really want you to come away from your legislative visits today establishing yourself as a valuable resource to members of the state legislature, but also to members of Congress as well. And there will be opportunities for that to happen. So I don't have a whole lot of time here, so I'm just going to slide by. Here's what I'm really trying to convey to you. You all coming together are a strong voice. And I think you have established that you are a respected source, i.e. Certificate of Honor, a trusted collaborator for legislators. And you can have a very strong policy impact at the state level, but also at the federal level. On the horizon, this slide is really just to give you some context of, what's sort of happening. We worked with the NGA and the National State Legislators Association to identify, what really are sort of the issues that we see will be on the horizon for the rest of this year, also into next year. And so obviously interoperability, analytics, health system transformation. What I think is really interesting that they identified as the role of health IT, particularly around surveillance and response, particularly with Zika on the horizon, influenza and other infectious diseases. So very quickly, I think I'm pretty much down to my last couple slides here. So those things are on the horizon. What I think is also important to note is with regard to some policy levers that can be broached at the state level, Medicaid modularization, and I don't think that's turning, so I'll just go. Medicaid modularization is a wonderful opportunity to consider. Because what I mentioned on the horizon, this idea of interoperability is spanning beyond just interoperability within healthcare, but it's also with human services, with public health, with other non-health related systems and services within the community. So there's a lot of opportunity there. The CMS has sort of looked at their investments over like $5 billion in the Medicaid IT enterprise, and really notice, by and large, there are about 5 or 6 large vendors that really have a hold of that MMIS process. So the idea is to expand now and to create opportunities, particularly around analytics, for smaller vendors to engage in utilizing this information. And again, the idea of interoperability across both the health and human services systems at your local and state level, as well as at the national level. What we do know, with regard to the health platforms, obviously for the Republicans, the focus on repealing the ACA, defunding the Medicare and Planned Parenthood budgets. For Democrats, it's obviously some things that we've heard around prescription drug prices and supporting Planned Parenthood and universal coverage. So there's a little bit of a dichotomy with the two prospective nominees, ACA versus single payer. So we'll have to see how that plays out. I think it will be very much focused on ACA and sort of the evolution of that. I would also just mention on the state landscape, we have 86 of 99 state legislative chambers that will be holding elections. Yeah, there we go. Republicans currently hold the majority of state chambers, as many of you may know. And then there are 31 states that are controlled by a trifecta, governors, Senate majority, and House majority leaders. We are really watching some battleground states, i.e. Michigan, Washington. I think we had someone from Washington here, Colorado, Ohio, et cetera. And so, finally, given all of this at play, I think it's really important to perhaps end with, California HIMSS chapters and their chapter advocates and leadership. Again, sort of reiterating what I mentioned earlier, you're a wonderful resource for information and support. Your constituents as well as thought leaderships. That's very much valued for policymakers. So you have to all give yourselves a pat on the back because for the good work that you're doing. It's very needed. It's valuable. As I said, I think HIMSS by and large is a trusted resource, and we want to continue to see that happen and grow and build relationships at the state level as well as the national level. You'll also get an opportunity during National Health IT Week, shameless plug, which is September 26th through 30th this year, hopefully to follow up on the meetings that you begin today, as well as depending on what's evolving or happening or coming to the forefront. I know you're going to hear about telehealth and telemedicine, so wonderful opportunity to leverage National Health IT Week to really get the word out there about the value of health IT and how you as chapter advocates and members can have a strong impact as one voice with state legislators and beyond. So with that,
Great job.
thank you.